Sandra Quijada from BSN 1B. And for this day, I will assess the client's temperature, pulse, respiration, and blood pressure. For the materials needed, I have here client's record sheet, ball pen, sphygmomanometer, alcohol and tissue for disinfection, thermometer, and stethoscope. Prior to this, let's introduce ourselves and verify the client's identity. Good afternoon, ma'am. I am Sandra Quijada from NUST and I'm your student nurse for today. May I ask for your name, age, and birthday?
My name is I'm 12 years old. And my birthday is December 23, 2000.
Okay, thank you, ma'am. Explain to the patient what are you going to do, why is it necessary, and how she can participate in the procedure. For today, ma'am, I'm going to assess your vital signs that includes your temperature, pulse, respiration, and blood pressure. This is important to know your baseline data, which we can use for further diagnosis. If you have any questions, feel free to ask. First, I will assess the client's temperature. But before that, I will perform hand hygiene. Make sure that our client is in the appropriate position. In this case, our client is in sitting position. Ma'am, are you comfortable?
Yes.
Okay, thank you. First, we'll get the thermometer. I will clean this with tissue and alcohol. From the tip to the body. And then place the thermometer to the appropriate root. Okay, now, I will now place the thermometer in the appropriate root, which is the axillary. Okay. We will now wait for the appropriate time or when we heard the sound that indicates that the reading is complete.
Kick.
Okay, it's done. And now I will record it in the client's record sheet. Okay. Now I'm going to disinfect the thermometer by using tissue and alcohol. But now we'll start cleaning from the tip to the body. Place it to the coat. Now that I'm done assessing the client's temperature, I'm now going to assess the client's pulse rate. I'm going to locate for the pulse point. After we locate the pulse point, palpate it with using 2 or 3 fingers, but I am more comfortable in using only 2 fingers. Okay, palpate. When you feel the pulse, get it for a full minute.
Kick.
After I get it, I will now record the result in the client's record sheet. Also observe for the pulse, rhythm, and volume. Now that I am done assessing the client's pulse rate, I am now going to assess the client's respiration rate. Just to remind, one inhalation and one expiration counts as one respiration. So now I'm going to observe the client's respiration for about 60 seconds. Ma'am, can I ask if you could cross your arms like this? Okay. I'm now going to observe and assess your respiration.
Gets kick.
Okay, now that I'm done, I'm going to record it to the client's record sheet. Also observe for the respiration's rhythm, depth, and respiration character. Now that I'm done in assessing your three vital signs, I'm now going to assess your blood pressure. Arms should be slightly flexed while forearm is supported at heart level. Ma'am, can I ask if you could flex your arm like this? Okay, thank you. Thank you. I will now rub the deflated cup to the client's arm. There should be a 1-inch distance to the antecubital space. And fingers should fit in the cup to make sure that the cup is not too tight. Since this is not our client's initial examination, no need to determine the systolic pressure. Because of that, we will going to assess the systolic pressure and diastolic pressure at the same time. Okay? First, I will clean the earpiece of the stethoscope with tissue and alcohol. And place it in my ears. Make sure that the stethoscope is really hung on at the diaphragm. And also, check if the amplifier is working or the sound is heard. If not, just twist it. Okay, it is good now. So now I will place the amplifier to the brachial artery of the patient. Okay. And make sure that the valve is tightly closed so that there will no air that are going to pass. The first loudest sound that is going to be heard is the systolic pressure. That is when the heart ejects blood to the left ventricle. While the weakest sound that is going to be heard is our diastolic pressure. That is when the heart is at rest. So now I am going to pump the blood.
Gets kick.
You are going to stop when you no longer heard the pulse. And slowly release the air. Now that the reading is complete, I'm going to remove my stethoscope and clean the earpiece. And remove the cuff. Remove the deflated cuff. Now that the reading is complete, I'm now going to write it at the client's record sheet for documentation. If there is abnormalities in the result, immediately report it to the primary care provider. That's all for today. Thank you for watching.